In this lecture, we will discuss hypocalcemia, including potential causes and EKG features. Hypocalcemia, or low serum calcium levels, can affect the EKG. Its changes are pretty much the opposite of those seen in hypercalcemia. That is, with hypocalcemia, we can see a prolonged QT interval with a shortened QRS interval. Despite the prolonged QT interval, torsades de pointes is rather rare, and the shortened QRS duration has no real clinical significance. So if you look here, okay, and if you've watched the hypercalcemia lecture, okay, you've noticed and seen this chart before. What we're looking at is our calcium levels here, and notice that we said if it's going towards the positive, that means there's an increase in calcium levels. If it goes towards the negative, there's a decrease. In this case, we're looking at hypocalcemia, a decrease in serum calcium concentration. Because of that, we are going towards the negative. And going towards the negative, notice that our QT interval will increase. So we see an increase in our QT interval, okay, as we noted here. We said torsades is rare, remember that. And then we can also see a decrease in the QRS interval, okay, going towards this negative portion. Here's our QRS interval. Here's our QRS complex. The interval is from the beginning to the end of it, okay, and we're going towards the negative arrow or negative mark there. So we're going to see a decrease in our QRS interval, okay? Remember, the decrease in the QRS interval has no real clinical significance, okay? Now, I want you to recall and notice that these are pretty much the opposite changes we saw in hypercalcemia. Now, some other less common EKG features include AV block, sinus bradycardia, sinoatrial block, and ventricular fibrillation, or VFib. Now, there are a number of causes of hypocalcemia that are listed here. Some of these include acute pancreatitis, pancreatic or parathyroid surgery, alkalosis from hyperventilation, sepsis, abnormal calcium absorption and resorption, rhabdomyolysis, renal failure, small bowel syndrome, excess calcitonin, and medications such as phenytoin and bisphosphonates, among many others. All right, let's review what we discussed before we end. So hypocalcemia is a result of low serum calcium levels, okay? We mentioned a number of causes, okay? Parathyroid surgery, notice our 4 parathyroids here. If you take one out, it may lead to this hypocalcemic state. Okay, and there's a number of other things, including medications, phenytoin, and bisphosphonates. So make sure and see if your patient's on it, if you see these. Now, common EKG features, the ones I want you to focus on, are pretty much the opposite of those in hypercalcemia. They are an increase in the QT interval. Remember, torsades is rare. Okay, we don't have really that R on T despite having a longer QT interval, as well as a decrease in this QRS interval. Remember, that doesn't really have much clinical significance, but that's something you could notice. Other rare changes we can see on the EKG are AV block, sinus bradycardia, so a slow sinus rhythm, sinoatrial block, as well as ventricular fibrillation. Well, that's the end of this lecture. We discussed hypocalcemia, including potential causes and EKG features. I hope you learned something.